Hello, everybody. Welcome to Surgery with Dr. Aprajya Shankar. Today, we are going to discuss the Saints Triad. What is the Saints Triad? The Saints Triad is a collection of three different diseases that occur simultaneously in a single patient. So, for example, these patients will have gallstone disease, hiatal hernias, and colonic diverticulosis at the same time. Diagnosis is basically the diagnosis is made on two or three different criteria. So, for example, you will require ultrasound to establish gallstone disease, and colonoscopy for colonic diverticulosis, and of course, endoscopy for hiatal hernias. Now, how do you manage Saints Triad? Now, because Saints Triad is a collection of three different conditions, um, the management depends entirely on surgical priority. So, for example, if the patient uh, had cholecystitis, we would deal with the cholecystitis first. If, for example, the patient had the had diverticulitis, which is the inflammation of the diverticula, then that would be managed first. And sometimes, in some cases, especially in my experience, we have had to deal with these patients in a successive manner. So, for example, they came to us with cholecystitis or pancreatitis caused by gallstones, and upon endoscopy, we discovered that they had a hiatal hernia, and a subsequent colonoscopy um, established colonic diverticulosis. So, in one of these patients, for example, we performed a cholecystectomy. A few months later, we had to perform a resection of some of the diverticuli. It was a segmental resection, and eventually these patients also this patient in specific required a hiatal hernia repair. So in some cases, you may have patients who require only one or two diseases which need to be managed. In some other patients, you might have to do all three of them, but those are very rare. What causes the Saints Triad? Well, we don't actually know what causes the Saints Triad. There have been many theories proposed, but none of them have any traction as of now. So, finally, if you'd like to learn more about surgery and you would like more surgical insight and help with exam preparation, especially if you're in Bulgaria, please follow us for more. Thank you.